As much as we say TB is an airborne disease, anyone can get TB. When it affects a loved one, it's painful.
Mzee wangu alikuwa amenikataa because nilikuwa mgonjwa sana. Akasema pengine hii ugonjwa umetoka kwa familia yako, whereby mpaka akanirudisha nyumbani kwetu, nikaenda nikaishi na wazazi wangu.
I'd lost a lot of friends. First I had to move from where I used to stay. I had to change my location.
Many Sudanese, they feel discriminated when they come to the hospital due to language barrier. Then they assume because they are foreigners, they cannot be treated well.
It reached a time nilikuwa nime give up. Kambia Dorothy, just let me just die.
There was a particular lady, her name is Margaret Ocheng. Margaret had given up in life, and in fact she's a very good story of someone who went to the grave and came back.
Mimi ilikuwa 2021 May. Nilianza kuwa mgonjwa sana. Mimi sikuwa najua about TB by that time. Niliwaste time nyingi sana private hospitals nikiambiwa ni infection, blood infection. So kuna siku nilikuwa nimeketi tu kwa nyumba nikaona advert kwa TV about TB. And nilikuwa by that time I was very sick. So nikaja hadi hapa referral. Then I went and see a doctor, nikamexplainia. Nikamuinsistia nataka kupimwa TB. That's how nilitumwa chest clinic. Nikatoa sputum, nikapimwa ikapatikana niko na TB.
TB ni ugonjwa. Hauwezi kataa na uko nayo. You have to accept. Na nika accept, juu nilikuwa niko naumia. Mpaka lazima nitibiwe. Na mimi nashukuru Mungu, hiyo madawa imenisaidia. Na bado niko naendelea kumeza mpaka nipone.
During my first relationship, my lady by then was diagnosed with TB. I wasn't aware about TB or anything. But by her coming to the clinic, she was advised to get me as well. Then I was screened and I was found to be positive. And I went the regimen for a year, which was quite tough then. But then I was still doing a lot of stuff, drugs and all that. So it was quite difficult.
So Margaret struggled, and then she had other issues of being abandoned at that very time, and then she had comorbidities that she was not willing to share. So I was the only person who would even go to the house and tell Margaret, take the medicine.
Dawa zilinikataa, nikakuwa zika affect liver, nikakuwa na jaundice, nikakuwa yellow all over. It reached a time nilikuwa nime give up. Kambia Dorothy, just let me just die. The moment nilikuwa na give up, Doro alikuwa anakuja na nichukua. She used to pay my fare, she used to pay my x-rays. Then hiyo friendship, it made me pia nikakuwa na nguvu ya kumeza sasa dawa. And that I took my drugs mpaka mwisho, then nikapona.
Sasa baada ya mimi kutibiwa nikapoako, vile nilipata matibabu kupoa, nikaona inashika kijana wangu. Kijana wa pili naona akaenda huko kutibiwa, akapatikana na akapatikana tena mwingine kijana kufuata. Alafu tena ya pili msichana na mchukuu wangu mdogo huyu Sahili. Lakini wako kwa matibabu, hawako vibaya sana, na nikaona matibabu ya TB afadhali uione na uone daktari na nipoa, ni bora.
I have not been infected by TB, but have been affected by TB thrice in my life. I lost my father, my aunt, and recently my mother also suffered from tuberculosis, but she has recovered. During my mom's treatment journey, I started coming with her to the hospital because the side effects on her were really adverse. She could not walk. She had memory lapses at times. and it reached a point where they said she was not delivering. And through her journey, I got to know more about TB, and I decided instead of being a victim, I should be the one to teach people about disease literacy on TB.
Well, I understand that TB kills, and I wouldn't want anybody dying from a disease that's curable. So I decided to advocate. I keep telling my friends, my peers to get tested.
So when I was involved in TB champion program, nilikuwa naenda church na mobilize watu kuhusu TB. Sasa nilikuwa naona ningependa kuwasaidia kama venye nilikuwa nasaidia aunti yangu.
Shida yenye mimi nilikuwa napitia kweli wapendwa, nilitengwa. Niwaambie, mimi nilitengwa na sikutaka. That's why niliamua nikakuwa TB champion, whereby naenda kwa community, kwa facilities na wafundisha kwamba hii TB si ati mtu akiwa nayo anatengwa ama aitwe majina fulani. Unapata mgonjwa ako na TB amewekewa vitu zake kando, amewekwa kwa room yake kando. Si hivyo, kwa sababu mtu tunasema TB mtu akianzishwa kumeza dawa haizi ambukiza.
We don't advocate for stigma for patients with TB. As long as the patient have started their medications, it's rare for them to transmit to other members. So we don't stigmatize. We tell them to sit in a place where there is good aeration. They make sure that they have opened the windows where they are seated, and also we encourage them not to avoid work. They go to work as usual, not to stigmatize themselves, not to avoid coming in contact with other people as long as they are on anti-TBs. So we avoid stigma.
Kazi ya champion ili encourage. Napenda kufanya kwa community, napenda hata kwenda kwa private hospitals. Nikiona mtu amelemewa pale, mimi nimwambia naenda kwa jaribu kupima TB kifua kikuu.
I have a database of 48 TB champions in Bungoma County, and they have gone through the exam, the 101 champions course, and then the ones that are very active in terms of doing TB work, beyond having the TB experience, I have like 22 of them. And I'm so glad that I've been part of the Bungoma County through the support of the CTLC, through the support of the sub-county TB coordinators, and even the staff. I can go to any, you come to Bungoma, they'll always tell you, unasema, when you mention the name Doro, they'll just tell you Dorowa TB. So me, I don't feel that Dorowa TB is stigmatizing, but they identify me with what they think I'm responding to well.
Well, my family were understanding, they were supportive throughout the journey. It's a journey that takes a year, so if you don't have basic support from your family, it might affect you in other ways. Yes, and also from the staff here at the hospital. They were really helpful.
Nashukuru Mungu kila wakati nilipata Madam Dorothy hapa ndani. Nilikuwa nikipata anything yenye na disturb my mind, nilikuwa nakuja kumwambia, akafanya akanishika mkono mpaka aka make sure nimeweza dawa. Hata nilikuwa kama nakosa kitu nampigia simu. Alikuwa kama mama yangu. Alinisaidia sana.
Naweza shukuru sana Dorothy na Gladys. Watu wa ku-encourage. Kama Dorothy alinifuatilia sana mpaka akajua kwangu. Alijikaza sana. Because alikuwa najua maybe naweza backslide anytime, niendelee na mambo ya kunywa na mambo kama hiyo. So alinifuata.
To have the facility-based support groups and the ones for community. So for the ones for facility, they are good. But we realized that most clients, they don't talk because they fear the service providers who give them everything are there. So hata kama nataka kusema kitu yenye ita inform feedback venye watritiwe, wanaogopa. But when we do the community ones, they really do what? They really open up. They even tell you, this stuff is rough, this one is good, we appreciate this, if you can change this, maybe the waiting hours are too long, they say it there. Or sometimes we do a home visitation, we tell them we went to the house and so and so. So from today when this person comes, Maybe this is why this client is always harsh. Ukimuuliza maneno, anagombana, ako na shida mingi, hana place ya kulala, this person is sleeping on her. Then that is when they start saying, okay, and then even then now they start bringing in their monies. They say, no, you said he doesn't have this. Someone can bring a blanket, someone can bring clothes, someone can bring jackets. You see, Bungoma can also mean to be very cold, and then we give to them. So you see, already now, through the concerted efforts of everyone, we think now we've taken the response to TB in terms of interventions and in terms of expert services being given to them has really improved. There is an activity we implemented for 10 months, starting January up to now. Our target for the end of the project was that from the community we were supposed to bring 135 new cases from the communities, because we are talking about the 40% that are in the community who have not come to the facility. And cumulatively, we achieved 237 new clients from the community. So what we did was to do the targeted outreaches where there is more TB. We also targeted informal settlements, and then we also had the transport corridor. We also had the aspect of having migrants. It is something that we have just started at the community level. Hatujafika ile kiwango sana nitasema tumeachieve. We still need to work hard on it, and that is why in our interventions sometimes there are people you cannot reach them straight. So that is why I thought of incorporating somebody to represent the migrants, somebody to represent the people at the bus park.
Msudi yote akikuja hapa OC, for example venye waliona biara amepona, wakikuja OC wana feel welcome, na imewachochea wanaweza kuja district wapate matibabu. Wakiniona district wanafurahia, wanasema one of our own ako hapa, anaweza tutetea kwa any department, naweza wapeleka kama CTB na labda kuna sickness nyingine naweza mpeleka, then I can translate.
It's quite challenging working with the private sector because one, most of them have not been trained on TB, and their guidelines also do not really, they are not focusing much on screening for TB.
The county referral hospital has helped us to manage the conditions. It has helped us to really give the best treatment to the patients, because most of the time they have come because of malaria, because of the additional support we get from the Bungoma County. Then we are able to manage all the conditions that the patient is having and to manage the TB.
They support us in terms of testing and equipping us with the items we use for collection in terms of sputum markers and transportation. They have a rider who normally comes to pick the sputum samples after the patient has collected.
They usually give us the small cards for the patient and also the big cards. They help us in taking the biodata of the patient and also where the patient comes from, so that it is easy for them to follow up after discharge. So we have the cards both for the patients and also for us to take the history and also be easy to follow up on the patient.
In terms of trainings, if we can be capacity built in terms of training, so that we can enhance our skills in sample collection and transportation, and also if they can support us in terms of items to use like Falcon tubes, we get them in time. The requisition forms, we can have them, and also in terms of if we have a patient who has turned positive, how can we track from our facility to the area where the patient comes from. It will help a lot in terms of reducing the percentage of positivity rates in the county.
Request the county government of Bungoma to step in and help us in waiving for chest x-rays for patients, because most of our patients have socioeconomic issues. Most of them are poor. So when you want to investigate for TB, you are limited to only sputum, which is free. Yeah. And also the partners to come in and support. feel happy, I feel encouraged, I feel like going on doing my work. It makes me wake up feeling good coming to work because at least there is somebody who is encouraging me. Taking 6 months drugs is not a joke. It's a long journey because we all know TB kills, but TB is curable.
Mimi nilikuwa nataka kuambia TB iko na tiba, usifikirie TB na tiba. Na TB unatibiwa na unapona. Kama utataka kutibiwa, huwezi pona, unakufa. Sasa mimi ni champion wa TB.
Yaani wenye wanaokopa nawaambia hiyo ni TB ni kawaida. Na ni kutibiwa free. Na ukitibiwa utapona.
Naweza ambia watu hivi, TB si lazima ukohoe. TB inaweza kushika sehemu yoyote isipokuwa nywele, makucha na meno. Na TB kupimwa ni bure, kutibiwa ni bure. Yeah. Watu wajitokeze tu, haichukui muda yote na dawa utapewa.
And in regards to those who are on treatment interruptions should not be there. If anyone is facing an issue during treatment, they should be free to talk to the healthcare workers. We have support groups where we really try to nurture their mental health. They should be free to talk to us. Yes.
Private hospital ndo nilikuwa nalitumia pesa nyingi sana. Lakini nilivyopatikana niko na TB nilitibiwa bure. Bure kabisa, nilipewa dawa bure. Everything nilikuwa na huduma bure, maybe tu fare ya kuja hospitali na x-ray ndo nilikuwa na gharamia.
I want to appreciate my coordinator, Dorothy. Yeah. I'm a mentor. Now I'm a powerful woman. Yeah.
Mimi nashukuru sana madaktari wametusaidia. Kwanza Sister Doro alikuwa ananipianga moral sana. Ya kuja kumeza dawa. Alafu nashukuru sana juu nilikuwa kwa hali mbaya sana.
Dorothy, I can just tell her to continue with that heart and may God bless her so much. Kwa sababu amefanya watu wengi wamekuwa na roho ya kumeza dawa, hata kama ulikuwa hauna hiyo hamu ya kupona, utapona mwenyewe.
Mimi nawashukuru sana, maana kama hawangesimama na mimi nilikuwa nimegive up, but they stand with me, wakanisaidia mpaka at the end.